Hello, I am Karil Faye Buka from BSN 212F, and today I am going to perform parenteral drug administration return demonstration. So the most common route for parenteral administration includes the intradermal, subcutaneous, intramuscular, and the intravenous route. But today I am going to perform the intradermal, intramuscular, and subcutaneous. So now first thing to do is to check for the doctor's order and the medication administration record. Okay. And next is check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So in administering for medication, we need to follow the 3 checks. So read the label of the medication when it is taken from the medication cart and before withdrawing the medication and also after withdrawing the medication. And now prepare the necessary equipment needed to conserve time and energy. So this include the syringes. So I have here the tuberculin syringe, insulin syringe, and the 5cc 23 syringes, aspirating needle, sterile water, a cotton balls that soak in 70% alcohol and the dry cotton ball, and also the waste receptacle. And now perform hand hygiene. So this is done to prevent the spread of microorganisms and observe other appropriate infection prevention procedure. And now I am going to proceed to the preparation of the medication from a vial. Now I have here the tuberculin syringe. So this is ideal for intradermal infections. Now open the package and always remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. And now I am going to loose it first to connect the syringe into the aspirin needle. And now open the aspirating needle. Then connect barrel into the aspirating needle, so ensure that the needle is firmly attached to the syringe. Then discard. And now remove the cap of the protective cuff of the sterile water. And then clean the rubber cap of a previous open vial with soak with 74% alcohol by rubbing in a circular motion. Then discard. Now remove the cap from the needle. And then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. And now inject the air into the vial, so keeping the level of the needle above the surface of the medication. And now withdraw the prescribed amount of medication. So invert the vial, ensure the needle tip is below the fluid level, and gradually withdraw the medication. Okay. And if necessary, tap the syringe barrel to dislodge any air bubbles present in the syringe. And after that, remove the aspirating needle, then dispose it to the waste receptacle. And now connect the barrel and the appropriate size of the needle. And after that, arrange the medication card on the hypodermic tray with the corresponding drug. Good morning, sir. I am Karil Feiduka, your student nurse for today. So for verification, sir, may I see your wristband? Please state your complete name and your birthday, please. Okay. So today, sir, what I am going to do is I am going to give you the medication through intradermal infection. So this is for us to know if you have any allergies and of course to know your skin sensitivity. So this may hurt a little, sir, and this will cause a bleb like a mosquito bites. Is that okay with you, sir? Okay, so do you have any question, clarification, sir? Okay, so before we begin, sir, is it okay if I close the door so that no one from the outside will be able to disturb us? Okay. So now position the patient's arm so that his elbow and forearm are supported in a flat surface. Okay. And now select the side 3 to 4 finger width below the antecubital space and one hand above the wrist. And next is avoid using sites that are tender, inflamed, or swollen. And next is never forget to apply clean gloves so that we can protect ourselves from the client and also prevent infection. And now cleanse the skin at the site using the cotton balls that soak in 70% alcohol. So firm it with a circular motion starting at the center and widening the circle outward. So center, then outward, then discard. So after that, prepare the syringe for the injection. And now remove the needle cup while waiting for the antiseptic to dry. And now expel any air bubbles from the syringe. Next is grasp the syringe in your dominant hand close to the hub, so holding it between the thumb and the forefinger. And with the non-dominant hand, pull the skin at the site until it is taut. So taut skin allows easier entry of the needle and less discomfort for the patient. So now let's insert the tip of the needle far enough to place of the level through the epidermis into the dermis. And now inject the medication carefully and slowly so that it produces a small wheal on the skin. So this verifies that the medication enters the dermis. Now withdraw the needle quickly at the same angle at which it was inserted. So activate the needle safely device. Discord. And so do not massage the area because massage can disperse the medication into the tissue. And now dispose the syringe and the needle into a sharp container. So already dispose the syringe and the needle into the waste receptacle. And so sir, we're done. So how are you feeling? Okay, so that's good, sir. So I will leave you now so that you can have some rest. But I will be back in 30 minutes so that I will check up on you. Okay. So after all the procedure, remove and discard the gloves and perform hand washing. So after that, documents all the findings and all the relevant data. And of course, after 30 minutes, go to the patient and observe if the patient has a positive or negative in skin test result. Now, let's proceed to the intramuscular injection. So, for the preparation of the ampule medication, prepare the syringe. So, I have here the 5cc gauge 23 syringe for my intramuscular injection. And now, open the package. So, if the syringe has already have a needle, then loosen up to connect the aspirating needle. So make sure that the syringe, make sure that the needle is firmly attached to the syringe. Then discard. And now let's get the ampule. So assuming that this is the ampule, and let's assume that I already do the steps. So now let's proceed to the withdrawing the medication. So place the ampule into a flat surface and then remove the cap of the needle. And now withdraw the amount of medication. And now recap the needle. Then take the aspirating needle off and then connect it to the appropriate needle. Discard, then connect to the appropriate needle. Then discard. And after that, place the medication card on the hypodermic tray with the corresponding drug. So, good morning, sir. I am Karine Faye Buka, your student nurse for today. So, for verification, sir, may I see your wristband? Please state your complete name and your birthday, please. Okay. So, today, sir, what I am going to do is I am going to give you the medication to you through intramuscular injection. So, this medication will directly go to your bloodstream. So, while I am injecting, sir, I want you to not to move so that you won't get hurt. So, is that okay, sir? Okay. So, do you have any clarification or concern? Okay. So before we start, sir, is it okay if I close the door so that the one from the outside will be able to disturb us while we're doing the procedure? Okay. And now assist the client into a chosen position, and of course depending on the chosen site. So appropriate positioning can give relaxation to the target muscle. And now select a site free from skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be off or to be frequently alternative the sides, so avoid using the same side twice in a row. So locate the exact site for the injection. So before doing the procedure, let me first apply clean gloves. And now clean the site with an antiseptic swab or cotton balls with that soak in 70% alcohol. So using a circular motion. So start at the center and move outward about 5 centimeters. Then discard. And then transfer and hold the swab between the third and fourth finger of your non-dominant hand. This is done to readiness for needle withdrawal. And now get the needle, and now remove the needle cover. So if using a prefilled unit dose medication, take the caution to avoid dripping the medication and the needle prior to injection. So if this does occur, wipe the medication off the needle with a sterile gauze, because medication left in the needle can cause pain when it is tracked to the subcutaneous tissue. And now inject the medication using the Z-track technique. Using the ulnar side of non-dominant hand, pull the skin up approximately 2.5 cm to the side under some circumstances, such as an emaciated client or an infant. The muscle may be pinched, so pulling the skin at subcutaneous tissue or pinching the muscle makes it firmer and facilitate the needle insertion. And also hold the syringe between the thumb and forefinger as if you're holding a pen, and pierce the skin quickly and smoothly at 90 degrees angle. So after inserting the needle, use a quick motion to lessen the client's discomfort. So before inserting the needle, hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. So aspirate for 5 to 10 seconds. So if the needle is in small blood vessel, it takes time for blood to appear. If blood appears in the syringe, withdraw the needle, then discard the syringe and prepare a new injection. So if blood does not appear, inject the medication steadily and slowly, approximately to 10 seconds per minute. Seconds per ml. While holding the syringe steady if using a ventrogluteal site. So injecting the medication slowly promotes comfort and allows the tissue to expand and begin absorption of medication. So holding the syringe steady minimize the discomfort, and after injection, wait 10 seconds if using the ventrogluteal site. So after withdrawing the needle, apply gently pressure at the site with a dry cotton ball. And after using alcohol swab may cause pain or burning sensation. If it is not necessary, don't massage the site of injection, because massaging the site of injection may cause leakage of the medication. So if bleeding occurs, apply pressure with a dry sterile gauze until it is stopped. So after that activate the needle safety device or discard the uncapped needle and attach syringe into the proper receptacle. Okay, so sir, we're done. How are you feeling? Are you okay? Okay, so sir, I will leave you now so that you can have some rest, okay? Okay. So after all the procedure, remove and discard the gloves and of course perform hand hygiene. So after that, documents all the relevant information such as the time of administration, the drug name, the dose, the route, and the patient reaction. So assess the effectiveness of the medication at the time of the medication expected to act. Good morning, sir. I'm Karil Faybuka, your student nurse for today. So for verification, sir, may I see your wristband? Please state your complete name and your birthday, please. Okay, thank you. So, Sir, the procedure that I will be doing today, because you cannot take the medication orally, I am going to give the medication to you through subcutaneous injection. So while I am injecting, sir, is that okay? Is that okay, sir, that you won't move for a minute? Okay. So thank you. So before we do you have any clarification or concern, sir? Okay, so before we begin, sir, is it okay if I close the door so that no one from the outside will be able to disturb us while we doing the procedure? Okay, so now let's select and clean the side of the patient. So select the side that free from tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation, or select the side that not has been used frequently. So before proceeding to the procedure, let us first apply clean gloves. And now clean the site with an antiseptic swabs or the cotton balls that soak with 70% alcohol. So start at the center of the site and clean in a widening circle to about 5 cm. So allow the area to dry thoroughly so that the mechanical action can remove the skin secretion that contains the microorganisms. And discard. And now let's prepare or place and hold the swab between the third and fourth fingers of the non-dominant hand. Or position the swab on the client's skin above the intended site. So using the technique keeps the swab readily accessible when that needle is withdrawn. Now inject the medication. So by doing so, grasp the syringe of your dominant hand by holding it with your thumb and fingers, with palm facing side or upward for about 45 degrees. So now using our non-dominant hand, let's pinch or spread the skin at the side and insert the needle using the dominant hand and a firm, steady push. Now, when the needle is inserted, move your non-dominant hand to the end of the plunger. So, holding the syringe steady and inject the medication at even pressure, minimize the discomfort of the patient. And now, let's remove the needle smoothly by pulling along the line insertion while depressing the skin with our non-dominant hand. So depressing the skin minimize the client discomfort after withdrawing the needle. So if bleeding occurs, apply pressure to the site with dry sterile gauze or dry cotton balls until it stops. So now, sir, can you please hold the cotton ball? Please, thank you. So after that, dispose the supplies appropriately. Okay, so after that, do the aftercare of equipment, use and remove the gloves, and of course perform hand hygiene. And after all the procedure, document all relevant information. So many agencies prefer that medication administration to be recorded on the medical record. That's it for my parenteral drug administration. Thank you for watching.